individuals who will volunteer to help our veterans. And yet, if you are a veteran and you show up at the U.S. Department of Veterans Affairs, you are met with, and I know they're working hard to change it under the Trump administration, I appreciate their efforts, but for most of the tenure as I've been governor, they meet a punishing bureaucracy. And it's almost like the red tape, it just defeats the purpose of why they're even going there, especially when people are leaving active duty. I remember when I was leaving active duty, they give me like a packet, and here I was. I mean, I had degrees from Yale and Harvard Law School, and I couldn't understand what they were doing. It was mind-numbing, and it's like, okay, we got to really get beyond that. So my wife launched an initiative in Florida, initially focusing on child welfare, called Hope Florida. And the thought from that is, instead of just being a bureaucracy, issuing a welfare check, particularly to moms with single moms with young kids, and creating that dependency, why don't we enlist all these other resources we have in our communities, our faith-based communities, our charities, our individuals, our businesses? So when someone goes in for assistance, their needs are put into what we call a care portal. The needs go out to all these other organizations. And I can tell you this, if you have a church or you have a charity or you have one of those stakeholders in the community who come and help, the results have been spectacular. Since we've put that in place, we've saved the taxpayer over $100 million, and we've gotten over 30,000 people off of means-tested welfare. So it's a great model to show that government does not have the answer to all the problems. In fact, they don't have the answer to very many problems. And so we thought to ourselves, why not apply that in the sphere of veteran support? So now with our Hope Florida model, a veteran goes in, if they go into one of Hammer's agencies, or buildings, they can do, and we are linking in all the groups. We have service dog groups. You have veterans with PTS. Instead of pumping them with drugs all the time, maybe look and see how that's been helpful to pair them with a service dog and help them lead very productive lives. We also have veterans mental health clinics that people have donated for that provide very good cutting-edge services to veterans in need. We've got folks that want to hire veterans. The possibilities are endless. So I think the key going forward to say, are we really doing all we can for veterans? It's whether it's at the local, the state, or the federal level, are you operating in a silo? Are you trying to delude yourself into thinking that just one turn of the bureaucracy is going to be what solves all veterans' issues? Or are you understanding that we have a reservoir of resources out there? People want to support veterans. In Florida, that's true. Look, I'm not saying like it's the same every part of the country. I know we got some people that think a lot differently than me, and many of you probably, and that's fine. But I know in Florida we have the ability to do it. So let's harness those resources, and let's make sure that the veterans are not limited to what one particular bureaucracy can provide. Because I can tell you, we will expand the horizons for veterans in need, and that could be a younger veteran who just gets out. It could be somebody that served in the Korean War. This is a model that works. And linking people with individuals who care. You look at the problems we've had with mental health with veterans and suicides. It's not always something that's going to be some magic medical intervention that may do the trick. It could be something as similar as a veteran's having a real hard time. Now people know through our initiative, they know about it. That word goes out to different volunteers in the community. And maybe somebody just comes to their house, says, hey, I want to take you to lunch, introduce themselves. I just want to let you know that we care about you. That can make the difference between somebody being able to lead a productive life and overcoming some of the mental health challenges that are so apparent, not just for veterans, but throughout our society. So we've got a good model. We're going to be working with the Trump administration to expand that model in the state of Florida. But make no mistake about it, there's not been any state that has put more emphasis on veterans issues than we have in Florida, and we are proud of that. And really, we should have no other choice. Florida is the only state in the country where both the lieutenant governor and the governor are military veterans. Of all 50 states, we're the only one.